Medication errors, over-medication, and side effects cost Americans $3.5 billion each year. And the CDC estimates much of it is preventable. And one way to prevent issues with medication is safe dosing. Now, Dr. Sharma, we hear about overdosing a lot, but these are tons of ways to misuse medication with the dose. So how does it happen?
So I think that a lot of it has to do with following the directions on the prescription. And it can be confusing. You know, you go to the doctor's office, there's a lot going on. They're talking to you about a prescription, and then you wait to get the prescription, or you go to the pharmacy and you get the information then. So I think getting clear information is really important. And then beyond that, trying to follow those directions. I know that it's not always easy to. We have busy lives, and this is unexpected. But following those directions is very, very important to complete the dose, taking the dose as directed, as often as you're supposed to, and for as many days as you're supposed to.
So what are common problems you see when it comes to dosage?
So very commonly that we see is, and I'm grateful when a patient admits that they're not taking a medication that the way that the doctor asked them to.
Right.
So it's helpful to know, certainly, one, how you're realistically taking that medication as a physician, because then we know when those results come back why maybe the results aren't where they're supposed to be. Oftentimes we would assume if you were taking it the way it should that maybe the medication is not working, and we either have to change the dose or add a new medication. So before doing that, if you can tell us, hey, you know, actually I've only been taking this once a day instead of twice a day, then we know what to expect with the results. Then we can talk a little bit about why is that happening? Is it because we're just busy and we can't remember? So a lot of times we'll tell patients, you know, if there's something that you have to take every day or twice a day, to put it, you know, somewhere near maybe your toothbrush, because, you know, you have to brush your teeth twice a day, and that'll be a little reminder. Nowadays we have our phones, which is really helpful, so you can set alarms and reminders to tell you when to take prescription medications. So trying to find ways to be a little bit more compliant is always helpful.